Bupa Cromwell Hospital was opened in 1981 and was taken over by Bupa in March 2008. It's a large 120-bedded private hospital situated right in the heart of Kensington and Chelsea, with 400 consultants from 50 different specialities. We also have a family medicine walk-in GP private service where we do screening, we offer primary care services, and we have a large involvement in the local community because of that. We also have a large diagnostics department with state-of-the-art MRI, angiography, bone density and digital mammography, and we have easy access for local GPs or from GPs outside the area, and we have direct access for people via the private GPs who have substantial practices within the hospital. The reason patients would decide to go privately is because the time factor. There's very rarely a wait here to see a doctor, and there would be very rarely a wait of more than 24 hours to have a test done. For something like a blood test, there is no waiting time. Mammography, ultrasound can usually be done on the same day, along with bone density, and they will almost always get an appointment with a private GP on the same day, even in the same morning that they phone up. And of course, we also, in the area of Kensington, have a large overseas population who are not registered with the NHS and would neither be eligible for going to the NHS or would want to. The diagnostic services at the Cromwell cater around the X-ray department, and we have state-of-the-art mammography with digital mammography, which is reported by top London consultants, usually from teaching hospitals. We also have a bone densitometry machine, which is readily available, and we've recently acquired a new angiography machine, which is really state-of-the-art with wonderful pictures. And we also have an up-to-date MRI department, CT, and a PET scanner.
Bone density is linked with the Well Woman Clinic, which deals with women issues in terms of their well-being. In that respect, we do mammography as well as looking at the woman's density of their bones, because at a particular age when a woman is going through the menopause, the hormonal levels change from time to time. So it's very good to know how mineralized their bones are. We do bone density scans to answer possible fractures, as well as looking at osteoporosis, osteopenia. We have a hologic machine which is very rapid in its diagnosis. We do 2 images of the left hip, purely because the left hip is closest to the radiographer, and we do the lower back as well, which is the lumbar region. These are areas where early changes of osteoporosis, osteopenia is significant and can be seen. We see some men as well, and we are looking at children as well, pediatrics.
This is the angiography unit here at the Bupa Cromwell Hospital. It's a new installation. It gives us state-of-the-art technology in terms of image resolution and also low-dose X-ray dose for patients. This means that we can give rapid diagnosis in terms of imaging for patients that are having their diagnostic procedure, and in some cases carry on and perform the complex interventional procedures that may be required in order to treat their disease.
Digital mammography at the Bupa Cromwell Hospital is one of our modalities that we use to diagnose breast cancer and the minor changes in the breast. The facility is quite fast and rapid in its diagnosis because we have managed to cut down on possible further views by manipulating the image on the digital network to get, for example, magnified images and to target the areas that we need to see. We've had digital mammography for the past 3 years now, and thus far we do symptomatic, some screening and breast assessments as well.
Patient satisfaction at the Cromwell is monitored quite carefully, and we have a patient questionnaire for both our inpatients and our outpatients. We also have a very robust department that looks at all complaints, and these are all followed up within national guidelines so that patients feel that they have their complaints or queries answered. In the last couple of years since Bupa came on board, this has become even more robust, and we're hoping to address things such as waiting times at desks, etc., etc. We're a very friendly, efficient hospital sitting in the heart of Kensington, and we have everything available that patients would need. We have a walk-in GP service available from 9 to 6 every day, where somebody requiring a doctor urgently and not registered or not able to get an appointment can be seen. We also have a fast-track GP service for all private and NHS doctors in the community who wish to have a patient admitted urgently, and we have a one-stop number so that if they phone this number, the patient can be admitted immediately under a consultant, and then the following day, if appropriate, referred to somebody else. And this is available to anybody.